Thank you, everyone, for joining us tonight as we highlight Module C of the Weight Management Certification with Dr. James Lavelle. We will be hosting this course live in December the 9th through the 11th in Las Vegas. Due to the very large audience we have this evening, if you do have a question, please use your chat option. James Lavelle is a nationally recognized clinical pharmacist, author, educator, industry consultant, and clinical practitioner, pioneer in the field of natural therapeutics. One of the nation's top influencers in legitimizing integrative medicine, Lavelle trains thousands of physicians and other healthcare professionals each year on the application of natural therapies in their contemporary practices. He was named one of the 50 most influential pharmacists by American Druggist magazine and the 2011 Clinician of the Year by the Natural Products Association. Lavelle founded Metabolic Code Enterprises to develop and launch his proprietary metabolic assessment platform for practitioners. Lavelle is also the author of more than 20 books and ebooks, including his recently released publication, Your Blood Never Lies, as well as his bestseller, Cracking the Metabolic Code and Nutritional Costs of Drugs. Thank you so much for joining us tonight. I'm going to turn the webinar over to you.
Great. Thanks, Lindsay. So, what I want to highlight is that I just literally had this case come into my office on Saturday, and it was a bariatric case, and she had already had 2 bariatric surgeries. So I'm going to give you a little bit of background, and then what we can do is we can kind of go into her as a case study and what we're going to do, how we're going to do it, and I think you're going to find it to be interesting because in this 3rd session with the bariatric surgery, I've got top bariatric surgeons that really think in an integrative way coming in. Dr. Salima out of Virginia General, Dr. Martindale, who's a leading bariatric MD that does a lot of research on nutrition out of Oklahoma State. There's just we've got some great clinicians that are going to be teaching. So without any further ado, let me get on to the next slides. So the first thing is, well, let me see. Let's hope the slides will move. There we go. So, when you think of bariatric surgery patients, and look, more and more people are qualifying, right? 78% of the population is overweight, 38% is now clinically obese. There's a lot of issues that you have to deal with. I mean, one of the biggest ones is reward and addiction, and we're going to go into that in a little bit. I'm going to highlight that in the talk tonight. And then there's other things like, complications of stress, memory erosion, eating pattern problems, night eating syndromes, craving patterns. They get nutrient depletions. They become anemic. They lose trace minerals. They lose things like magnesium. They begin to get cramped. They have exercise and movement problems, so they develop things like arthritis. It's a big comorbidity of people that are obese. And then they have sleep issues, and that's not always evaluated correctly because if they don't have apnea, they're not necessarily being asked about their sleep. And then, of course, there's the issues around gut health and their gut hormones and what that can do and how the microbiome has this dramatic effect we're finding out on weight gain. And then, of course, hunger management, really understanding the fact that gut hormones play a huge role in the appetite, in signaling from the gut to the brain for satiety and hormonal patterns. So, the reward cascade is, I find to be probably the most significant thing. I don't care, all of you guys have had people that have done the Atkins diet, lost 60 pounds, then you see them, and they gain 70 back, and people can't tend to manage their appetite now. And so, to me, this is probably the single biggest thing that you can do. Now, obviously, in this bariatric, weekend, we're going to talk about, a lot of other things, like how to manage the bariatric patient nutritionally, and, what goes on with skin, and, how they may need surgery for getting rid of loose skin. But the bottom line is that the more you get under stress, the more your serotonin pool gets out of balance, the more your dopamine gets compromised, the more you end up with increased addictions and increased craving patterns. And as we know, right, a lot of people that have bariatric surgery either eat through their surgery or they end up with other addictions like alcoholism, drugs. They take up smoking, they take up gambling. So they end up still having other reward issues. So this aspect of really learning, and this is what I'm going to be, talking about or focusing on in this weekend, is really trying to overcome reward addiction craving patterns in these individuals. And obviously, serotonin is the sweet tooth neurochemical, but as the serotonin starts to drop, it starts to influence dopamine receptor function as well. So, it's that story of, you can start out with a little bit of comfort eating, but then that little bit of comfort compulsion turns into a compulsive disorder where you can't stop. So it's one thing to want something sweet. It's another thing that you have to want something sweet continually. And so, that's one of the biggest issues that comes on with these individuals. And then there's these issues of, so we're telling people now to eat higher fat diets. And this is a big issue, right? Because everybody's saying, oh, no, you got to go paleo, you got to go ketogenic. Well, the reality is that you can get into compensatory overfeeding with higher fat diets. So this whole gut lipid messenger and high dietary fat becomes a huge issue as it relates to what's going on in the individual. So the more fat that they take in, they can literally begin to trigger a reduction in dopamine signaling. Let me get to the next slide. And then, of course, there's this next issue, which I think you're going to find to be quite interesting on this gal that we're going to look at. Which is low-grade inflammation, and that low-grade inflammation is triggering imbalances in our insulin receptors. And those insulin receptors are now becoming sluggish, and they start to store fat more easily. And of course, if you don't have adequate beneficial flora, you can't dampen that inflammatory signaling, which is kind of one of the major things that's going on with the microbiome. Let me see if I can get this up. So the biggest issue that relates to this, of course, is that you have a lot of individuals, especially people that are obese, have got a rich history of being on NSAIDs. They have been on, they've been on a lot of antibiotics. They've been on pain meds, things like opioids that alter the mechanics of their GI tract. And so, that causes this imbalance in their gut microbiome. And the interesting thing here is that the same regions in the brain that are activated with drugs and craving behaviors are the same ones that relate to food behaviors. So people that are addicted to drug therapies are similarly addicted to foods. And this, I think, is incredible, that literally there are studies that show that for obese people, they have decreased numbers of dopamine D2 receptors. And the dopamine D2 receptor is the same dopaminergic firing that takes on people with alcoholism. So when you're deficient in D2 receptors, you tend towards craving and reward behaviors and binge behaviors. The higher your BMI, the lower the number of the receptors. And then also what isn't realized is that when you're hyperinsulinemic, it interferes with dopamine clearance, and now you can't get enough reward. So if you talk to people with diabetes, they'll overeat carbohydrates all the time. And if you don't get their dopamine corrected, and you don't get their dopamine receptors activated, you can't ever get to control their appetite, which is one of the biggest things. Once again, when I talk to people and interview them, people that are overweight and they want to lose weight, the big reason they come back to go to the weight loss centers is I'm going to get my amphetamine, I'm going to get my dopamine hit. It's the number one thing that they say is the reason that they come back. And of course, these imbalances end up creating, as I said, it triggers significant behavior. It can also contribute to aggressive behavior. And here's the most interesting thing, is if you just start to load a lot of tryptophan into an individual, or you load a lot of, say, tyrosine into an individual, you're trying to build up their their dopamine pool, or their norepinephrine pool, or their tryptophan pool. If you selectively upregulate one of these amino acids, it actually can lead to depleting other amino acids. So you always want to think about how you need to give these amino acids in concert, even if you're trying to get a greater concentration of one or the other. Oh my God, I can't believe this. So let's go over this case study. So this is a 49-year-old female, and she came in and she started gaining weight as a teen once her menstrual cycle started. She gained weight up to 335 pounds. She's 5'4". She had bariatric surgery at age 34. So she had a gastric bypass, and they took out her gallbladder. She lost weight down to 190 pounds, but the problem is they needed to do a second surgery for her to repair the first surgery, because the first surgery she was throwing up. They didn't know why. Then apparently what they had done is they had stapled her stomach incorrectly. So that second surgery lasted for these last 15 years, and she's fluctuated between 220 and 260 pounds. But the problem is, so she's happy she's not 335 pounds, but the problem is that even at her current weight of 235 pounds, now her knees are giving out on her. She has a lot of osteoarthritis. Her knees are giving out. She's got her first cortisone shot. What are the symptoms that she had? Well, she first of all said she's got a savory palate. She wakes up alert at 4 a.m. She's got bad breath, body odor. She gets muscle cramps and muscle spasms. She, she has an MTHFR gene SNP, and she's homozygous for the 1298 gene SNP. She has chronic low-grade anemia, so she's B12 deficient, and her mental cognition is starting to erode, and she was always able to be sharp thinking, and this is starting to erode on her. She has a big drop in energy at 3 p.m. She's a poor pill taker due to the surgery. She literally showed me she had to massage her throat to get pills to go down. And then fatty foods would trigger heart palpitations, as would going too long without eating. So she goes too long without eating, or she has, eats too high a fat meal, she runs into a problem with, it was literally triggering these palpitations. But she's even had a couple events where she's passed out. So hold on one second. So in her questionnaire, she showed she was, under high stress, overcommitted, craves carbs, especially in the afternoon. She gets tired after big meals. She's irritable, snaps at friends, coworkers, and families. She gets 50% of her calories after 5 p.m. There's a lack of adequate sleep. She replays the events of the days in her mind, and she has muscle cramps and muscle spasms. She also ends up with a light-colored and yellowish stool. So this is somebody that had a bariatric surgery, and her weight's down. Her weight's down 70, 80 pounds, but at the same time, even though her weight's down 70, 80 pounds, look at all the things she's dealing with. She's got, 2 knees that are getting shot with cortisone. Her digestion is off. She's irritable. Her sleep is disturbed. She's craving carbohydrates. Everybody just thought because she would lose the weight, because when, of course, you do a surgery, that everything's going to get better. But in her case, yeah, some weight came off, but they still weren't managing all the other side effects of her situation. So let's take a look at her labs. So her labs, pretty uneventful, really, when you think of it. This is the interesting thing, and it made me think of a lot of the studies which showed that a lot of labs normalize when people get gastric bypass. Well, yeah, their labs normalize, but nobody's doing a quality of life survey. So, her 81 HDL is good, or 77 LDL is good, and that's unmedicated. Her triglycerides are 95, that's good. Her blood sugar was 87, that's good. But look at this, her CRP was 1.4, so she still has that low-grade inflammation. Her sodium at 138 indicates she's under chronic stress, right, because the adrenal glands take up sodium. She does get some dizziness on standing. Her potassium is at 401. She does say that when she doesn't hydrate enough, she can get palpitations too. her hemoglobin A1C was good. Her T4 and free T3 were just trending low. But look at her ferritin and her red cell width. The red cell width is at 16.3. Her ferritin's at 14. So where do you start with this person? This is probably the biggest thing, is because here's the thing we got to keep in mind. She isn't going to be able to swallow a lot of pills. That's the very first thing that she told me, is that, you know, I just can't swallow a lot of pills. So we've got to get creative, and we got to think about how we're going to attack this bariatric person. So the first thing is you know, we can calm a stress response by using heart rate variability. So, you know, we prescribed, this is what I did 2 days ago, guys. We gave her heart math by inner balance. So what we could do is get her to start doing some deep breathing, get her to calm her nervous system down. Obviously, because she's easy to get the palpitations, it's an issue. She's under the care of, you know, 2 different docs. They've checked out her heart. There are no problems with her heart. She perseverates at night. So she has, so then we're going to compound some oral theanine spray. We use this, gosh, we worked with Corvette race drivers. You can get oral theanine spray compounded, 50 milligrams per dose, sublingual absorption, and this will really help reduce her stress and reduce her perseveration. The other thing is that, you know, blood glucose drops. Now, chromium tablets are really small, so we gave her 2 500 microgram chromium tablets that are very tiny. She could even chew them up if she needed to. The next thing is now we've got to figure out how we can keep her blood sugar stable, because obviously, even though her blood sugar is 87, she's dysglycemic. She crashes midday. If she goes too long without eating, she notices herself getting agitated or getting anxious. So we would use resistant starch for that, and I've got a couple slides in here at the tail end of this to show you on that. So we would use some resistant starch known as UCAN, and we would mix it into food or have her do a shake in the morning. The nice thing about this is you can even blend it in with soup, and we'll show you the benefits of that in just a minute. Then in addition to that, we would give her some collagen protein. So I know you can use whey protein, you can use plant protein, but we picked collagen protein because you want the collagen to help support her cartilage and ligaments in her knees. And so you can get, so we had her doing collagen protein twice a day. And then we started her on an allergy elimination diet. So she sat with our dietitian and began an allergy elimination diet, which got rid of the 8 major allergens, got her off of dairy, got her off of gluten, and she'd never been on an elimination diet before. And so we got her started with that. Now, for her muscle cramps, you know, we added some powdered magnesium. And then the last thing, because she was very concerned about how lax his skin has gotten, you know, she did have, her goal was to get down to about 200 pounds. So she's gonna, you know, she's got a lot of lax skin, and so we recommended that she does a surgical consult. So in this case, if you think through with her, we need to calm her nervous system down to reduce her stress so she doesn't crave as much. That's the theanine. We could also do something for her dopamine, which I'm going to go into in just a moment. But the big thing is that, you know, straighten out her blood sugar, get her to perseverate less, get her to calm down, and then start to work on getting her some of her gross trace minerals under control. So these were studies on using resistant starch, and, you know, resistant starch, when you add resistant starch to food, especially in obese individuals or people with metabolic syndrome, it upregulates glucagon-like peptide and PYY. And it does it in humans too. I know this study was in rodents, but they've also shown this in humans. And the value to this, of course, is that it helps to create a satiety signal in people, so their gut hormones start to normalize. One of the toughest things is if they aren't getting the satiety signal from the gut, that means that they're going to continue to feed in a hedonic way. So what are one of the key things you can do for, you know, for dopamine? And so this is kind of new. I know, you know, if you come to the webinar or you come to the seminar, you will get a lot of information on kind of what the latest ways to compound are for weight loss, how to target your patients, what they can do for, managing their appetite. And here's one of the examples, theacrine. Theacrine is a really interesting tea extract that just came onto the market, and it's very similar to caffeine. The only difference is it doesn't cause you to feel stimulated, and instead it causes you to feel alert and focused, but not agitated. So this is a really interesting compound. You also don't habituate to it, so you never really get used to the, your body never habituates to the dose, so you never have to increase it. And there's been interesting studies with theacrine because it helps improve dopamine levels. It modulates other neurotransmitters, and it also decreases reactive oxygen species and inflammatory cytokines in the brain. This is out of the journal Phytochemistry back in 2002. This is a product that just came onto the market in this last year. We actually started developing, interestingly, started putting this theacrine into dark chocolate. So we would have our compounding pharmacy put this into a dark chocolate, so someone could suck on that dark chocolate, get the dopamine reward hit, and get the focus and mental benefit without feeling agitated or feeling too jittery, much like what the anorexic drugs do. So this is a pretty sharp ingredient. And how does it work? I mean, one is it binds to adenosine receptors, so it decreases adenosine levels, helps to improve dopamine receptor activation. It's been shown to improve reaction time, concentration, and focus. So this is a brand new study out of the Journal of International Society of Sports Nutrition, and it's published recently. I think it was 2014 or 15. But this is an incredibly interesting compound because athletes get deficient in dopamine and therefore their performance goes down. People that get overweight get deficient in dopamine and their appetite goes up. So dopamine is centrally involved in so many aspects for wide swaths of the population. So I thought I had another slide in there. Well, let me see. I guess I don't. Well, that's okay. So the big thing that we have to do with these individuals is we have to be able to really take command and control of their nervous system. We have to be able to get them to control appetite. I'm telling you guys, you get their, everybody talks about, hey, put them on a 1,500 calorie diet and get people to exercise and they will lose weight. Some people will. Other people that won't budge because they have other metabolic issues, like we went through in Section A and B of the weight loss certification, or we went through environmental toxins and adrenal stress and blood sugar and food allergies. In other situations, you have these morbidly obese folks who simply have downregulated their dopamine receptor so much that they can't control appetite, and their microbiome is not signaling their brain to shut off their control for food, so they continue to overfeed. And so what I hope you get out of this third installment of the weight loss certification, it's everything you want to know about bariatrics, but it's looking at it from a perspective greater than just do the surgery, teach them how to eat, and hopefully get them to exercise. It's what are all the other aspects that need to be controlled in the bariatric case. And I think this case that I went through elicits it. It just shows it perfectly, right? She's still having problems with her stool. She still has problems with stress. She's not sleeping well. She can't move. Nobody's telling her what she can do for exercise. There's a whole series of things that if we really want to manage this bariatric patient population, we need to be more understanding of all the biochemical shifts that are going on in them. Lindsay, I think probably give questions. I know you said that we kept it around 30 minutes, so that's what I kept it to.
Sure, absolutely. If anyone does have a question, please use your chat option. Before we get to a question, I just want to thank everyone for joining us tonight, especially you, Dr. Lavelle. We do have a very special tuition rate for those who do register this evening. Again, the course will be in December in Las Vegas, the 9th through the 11th. You will save up to $1,000 off of the course. Certainly give me a call directly at 561-777-6807, or you can email me at Lindsay, Lindsay, @a4m.com. I do have a question. Where can you buy theophylline?
It will be coming out in the marketplace. I think that I know that Designs for Health has theophylline in one of their products. Specialty Formulas has it in the powdered form. If you want to try to do something like that chocolate that I described, which I'm telling you, people on the weight loss love it. I get that done through Specialty Pharmacy. Ray Solano is the guy that makes it for me. So if anybody wants that, I'll be glad to pass that on. But it's a brand new ingredient in the market. I'm telling you guys, I've been playing with it now for a year. I've made liquid drops. I've made all kinds of things out of it, and people love it because it gives them the attention, the focus. It boosts that kind of brightness that they're looking for without giving them, the adrenal burnout you get when you have people on amphetamines. So, if you can take a look at Specialty Pharmacy or Austin Compounding, and Ray Solano, he makes those chocolates for me, and I know he's got theophylline powder there. And if not, a capsule of it, I think, is available through Designs for Health. And there's a lot of other things there's a lot of other things that, guys, we'll go over agents like Evodia extract, which upregulates, tryptophan hydroxylase in the brain, has been shown to work in obesity and does really well with in women losing belly fat. A lot of these novel ingredients we go through during the course.
I do have one more question. Have people tried carbidopa, levodopa to enhance dopamine production in obese patients?
That's a great question. In fact, in Module 2, we talked about compounding with carbidopa and 5-HTP. Remember, you don't want to upregulate dopamine too much and not have enough, serotonin on board. So actually, there's carbidopa in small doses, 5 milligrams, with 5-HTP that you can get done with compounding pharmacy, and then use that in your obese patients to help manage appetite. I think it's a good strategy, especially for people who are resistant to other methods of getting their dopamine pulls up. In fact, I should mention, we go through a whole strategy of what you can use for compounds. For example, this woman needed B12. She needed B12 injections, but she was getting tired of doing injections. So we had her do. We called in doing a methylation cream, or a vitamin B12 cream for her that the compounders put together. So we've got a whole series on kind of compounding and unique components that Robert Seek is going to be teaching in his course during module, the third installment in this weight loss module. So we got a compounding pharmacist who's going to be teaching a lot of this.
Great, thank you so much. If anyone does have any further questions, please submit them in the chat option and we will address them by email. Again, I want to thank everyone for joining us this evening. Please give me a call to register at 561-777-6807.